This is healthy tenacity. However, it can become a repetition compulsion, which is really an obsession. When a person cannot master a task, they often become desperately obsessed with that task until they figure out what they have done wrong and how they can succeed in solving the problem. They fail to realize that something is wrong with their approach. There is often a blind spot where the solution really resides. Instead of looking at the problem in a different fashion and trying to discover a new way to respond, the person attempts the same technique over and over again, which results in the repeated failure and frustration. This tendency is the origin of Freud's repetition compulsion. It is a misguided attempt at the concept of mastery, which is healthy. This psychological dilemma is best illustrated by a sad but all too common tendency. When a parent has sexually abused a child, that child will dissociate and essentially go into immediate shock. This state of shock is very similar to hypnosis. Under hypnosis, a person becomes more suggestible. Therefore, the child will remember on some level and in great detail everything that has occurred while in that state. He or she will vividly remember everything about what it was like to feel like that victim, and also everything about what it is like to be an abuser. He or she will remember what clothes they were dressed in, the time of day, and the furniture in the room. They also remember what the abuser was wearing, the tone of their voice, and a number of other details, all subconsciously. A child that is sexually abused will have essentially two models of behavior. One is the victim, and the other is the abuser. This will be especially confusing because the abuser may be seen as quite loving in other situations, especially if it was a parent. The child will then want to find a black or white answer to the confusion. This concrete and absolute thinking is a normal characteristic of a child's thought process under the age of 12. The way a child attempts to resolve this conflict is to internalize the two models. Essentially, a civil war develops when one part of the child feels like a good person who has been victimized, and the other part acts like the original abuser and tells the child that they are worthless and deserved it. The problem has no resolution, however, because the two sides are usually equally matched. In a failed attempt out of this stalemate, they often subconsciously recruit a third person to either abuse or receive abuse from. Although an abused child will identify with both the abuser and the victim, they usually specialize and follow one model more than the other. This sets up a hot spot where increased psychic energy resides. It also sets up a double goal. The child will feel they are lovable and want love, but also feel unlovable and want to be rejected. This conflict will be mostly subconscious, and without consciously knowing, as adults, they choose partners with a combination of their parents' characteristics or whoever abused them. They will, as if by radar, subconsciously pick the one person out of a crowded room that has a similar problem to what they experienced with significant people in their past. If they identify more with the victim, they are drawn towards an abuser. And if they identify with the abuser, they are drawn towards a victim in a very similar manner. Usually, people have 1 to 5 areas that they need to work on that remain unresolved from childhood. Until the areas of work are complete, they will seek out partners in order to resolve these problem areas subconsciously. Consciously, they will move towards success in love, but subconsciously end up with exactly what they need to relive their history. Often, even if they are aware of these hot spots or blind areas and consciously try not to repeat, they are invariably drawn into the same snare or repetition compulsion. These recurring hot spots or blind areas give the clues needed to work through the issues and allow the person to grow, individuate, and truly develop as a mature individual. Patrick Carnes, who specializes in this area, calls these hot spots trauma bonds. When someone does something abusive to a person, that person will become overly involved with the person and bond with them in an unhealthy manner. The abused person seems to recognize and become attracted to abusers and repeat the abuse. If they don't replicate the abuse, they will bond with the particular type of person who was abusive. Carnes also believes trauma reactions are physiological or psychological alarm reactions from unresolved trauma experiences. These are the myriad of symptoms that occur naturally in a person who has been traumatized, such as hallucinations or sleeplessness. Trauma pleasure is seen in his schema as the seeking and finding pleasure in the presence of extreme danger, violence, risk, or shame. It doesn't mean the person really enjoys this deep inside. In fact, they often hate it. But the tendency is to love it and to hate it, and at least be drawn to it because it's a hot spot. So if the person has been raped, the tendency is to engage in risky or violent, promiscuous behavior, such as becoming a prostitute or a topless dancer. Trauma blocking is the effort to numb, block out, or overwhelm residual feelings due to the trauma, usually by dissociation techniques, alcohol, food, drugs, or by keeping busy and working constantly. The PTSD sufferer will try almost anything to keep the troubling memory and feelings of the abused repressed, and they usually don't even know it. Trauma splitting is ignoring traumatic realities by splitting off experience and not integrating it into personality or daily life. The most extreme examples of this would be dissociative identity disorder, which is more commonly known as multiple personality disorder. There are numerous less dramatic ways to accomplish this dissociation, such as daydreaming, preoccupation, and feeling overwhelmingly tired when a button out of the past is activated. Trauma abstinence is when a person compulsively deprives themselves, and this occurs especially around moments of success, high stress, shame, or anxiety. A person who displays trauma abstinence will have periods of time where they deprive themselves of food, sex, excitement, or success in order to punish themselves and to prove that they have control. The tendency here is to almost succeed and get out of the pattern of self-destruction. But because there's a double bind situation that's occurring, part of the person desperately wants to get better, while a part of them wants to remain exactly the same. This is because the PTSD sufferer has not only internalized the position of themselves as a victim, but also the role of the abuser. Both have a job to do, and they often cancel each other out. Therefore, at the moment of success, the person often does something odd that guarantees failure and frustration.